Welcome to my YouTube channel. Please subscribe my YouTube channel and press the bell icon button. Today I am telling to you about how much sleep do we really need. Scientific research makes clear that sleep is essential at any age. Sleep powers the mind, restores the body, and fortifies virtually every system in the body. But how much sleep do we really need in order to get these benefits? National Sleep Foundation guidelines advise that healthy adults need between 7 and 9 hours of sleep per night. Babies, young children, and teens need even more sleep to enable their growth and development. People over 65 should also get 7 to 8 hours per night. Knowing the general recommendation for how much sleep you need is a first step. Then it's important to reflect on your individual needs based on factors like your activity level and overall health. And finally, of course, it's necessary to apply health sleep tips so that you can actually get the full night's sleep that's recommended. Please subscribe my YouTube channel and press the bell icon button. Recommended sleep times by age groups. Recommended sleep times are broken down into 9 age groups. In each group, the guidelines present a recommended range of night sleep duration for healthy individuals. In some cases, sleeping an hour more or less than generally range may be acceptable based on a person's circumstances. Newborn baby 0 to 3-month old recommended hours of sleep 14 to 17 hours. Infant 4 to 11-month old 12 to 15 hours. So it's equal how much sleep do you need? These guidelines serve as a rule of thumb for how much sleep children and adults need while acknowledging that the idea amount of sleep can vary from person to person. Please subscribe my YouTube channel and press the bell icon button. For that reasons, the guidelines list a range of hours for each age group. The recommendation also acknowledges that for some people with unique circumstances, there is some wiggle room on either side of the range for acceptable, though still not optimal amount of sleep. Deciding how much sleep you need means considering your overall health, daily activities, and typical sleep patterns. Some questions that you help assess your individual sleep needs include: are you productive, healthy, and happy on 7 hours of sleep, or have a noticed that you require more hours of sleep to get into high gear? Do you have coexisting health issues? Are you at high risk for any disease? Do you have a high level of daily energy expenditure? And do you frequently play sports or work in a labor intensive job? Do your daily activities require alternates to do them safely? Do you drive every day and or operate heavy machinery? Do you ever feel sleepy when doing these activities? Are you experiencing or do you have a history of sleeping problems? Do you depend on a caffeine to get you through the day? When you have an open schedule, do you sleep more than you do on a typically work day? Start with the above mentioned recommendation and then use your answers to these questions to home in on your optimal amount of sleep. Please subscribe my YouTube channel and press the bell icon button. How are the recommendation created? To create these recommended sleep times, an expert panel of 18 people was convened from different fields of science and medicine. The members of the panel reviewed hundreds of validated research studies about sleep duration and key health outcomes like cardiovascular disease, depression, pain, and diabetes. After studying the evidence, the panel used several rounds of voting and discussion to narrow down the range for the amount of sleep needed at different ages. In total, this process took over 9 months to complete. Other organizations such as the American Academy of Sleep Medicine and Sleep Research Society have also published recommendations for the amount of sleep needed for adults and children. In the general, these organizations closely coincide in their findings, as do similar organizations in Canada. Please subscribe my YouTube channel and press the bell icon button. Improve yourself. Sleep today, make sleep a priority. Once you have a nightly goal based on the hours of sleep that you need, it's time to start planning for how to make that a reality. Start by making sleep a priority in your schedule. This means budgeting for the hours you need so that work or social activities don't trade off with sleep. While cutting sleep short may be tempting in the moment, it does not pay off because sleep is essential to being at your best both mentally and physically. Improve your sleep hygiene, which includes your bedroom setting and sleep related habits, is an established way to get better rest. Examples of sleep hygiene improvement include sticking to the same sleep schedule every day, even on weekends, practicing a relaxing pre-bed routine to make it easier to fall asleep quickly, choosing the best mattress that is supportive and comfortable, and outfitting it with the best pillows and bedding, minimizing potential disruptions from light and sound while optimizing your bedroom temperature and aroma, disconnecting from electronic devices like mobile phones and laptops for a half hour or more before bed, carefully monitoring your intake of caffeine and alcohol and trying to avoid consuming them in the hours before bed. If you are a parent, many of the same tips apply to help children and teens get the recommended amount of sleep that the need for kids. Their age pointers for parents can help with teens, especially who face a number of unique sleep challenges. Please subscribe my YouTube channel and press the bell icon button. Getting more sleep is a key part of the question, but remember that it's not just about sleep quantity, quality sleep matters too, and it's possible to get the hours that you need but not feel refreshed because your sleep is fragmented or non-restorative. For children, improving sleep hygiene often boasts with the quantity and quality of your sleep. Thank you for watching this.